The World Health Organization, WHO, has revealed Ghana is one of the countries driving the increase in COVID-19 cases in Africa. WHO says 190,000 people are expected to die from the disease in the continent. Ghana is one of the countries with the highest number of cases. Dr. Mary Stephen explains why this is worrying.
The number of cases you see when you test depends on the kind of transmission pattern you have. So really, if you have community transmission, you will pick quite a number of cases when you test. And even if you do not test, for instance, we said earlier 20%, 15% will present with severe disease and 5% with critical illness. So you have 20%, which is quite a number of cases, especially in big countries. So they will present in the hospitals at the end of the day, or it will present as community death, which will be picked. So, but if you have a country that is reporting sporadic cases or cluster of cases, no matter how much you test, you will still not pick so many cases. So it actually depends on the kind of transmission you have in the country.
What you're saying is that argument is moot.
So like I said, yes, it depends on the transmission. The number of cases you pick, it depends on the transmission pattern. So if you have community cases, you will pick more cases. Community transmission, you will pick more cases, definitely. In Africa, we are seeing an increasing trend in the number of COVID-19 cases. 10 countries are driving this outbreak, and of course, we know that South Africa is reporting the highest number of cases, but Nigeria and Ghana are also part of these 10 countries. So we still see increasing number of daily cases on the continent, and if we don't ramp up our public health and those physical measures, we might continue to see additional number of cases on the continent. So basically, we need to ramp up all the capacities for detection, testing, isolation, treatment, and contact tracing, including the preventive measures by the community. So we all have a personal responsibility in addition to what government is doing to make sure that we do not expose more people to the risks of contracting COVID-19. Of course, if people continue to interact, no proper hand washing, they are not observing the 1 meter distance, they are not wearing their face masks, you expect that cases will continue to increase and doubling time will continue to shorten. And with this, we will continue to see increase in number of cases. So basically, we need to make sure that these capacities are on ground and unnecessary interaction is actually being avoided, or if it must be done, we must have facilities to make sure that we reduce the risk of exposure.